Next at 5, children have been fairly low risk when it comes to COVID-19, but Wisconsin is now seeing more cases in kids than any other age group.
Yes, more students are back in the classroom, but some local doctors think it's students gathering away from those buildings that's leading to the rise. Amanda Quintana found out what you need to do to protect kids who can't be vaccinated yet. Amanda?
In Michigan, more kids are being hospitalized. In Minnesota, hundreds of schools are reporting cases of the variant. And here in Wisconsin, we're seeing a 56% increase in child COVID cases, showing that we need to do something now to make sure that there's not more spread.
There's actually probably two things going on. There's the variant, and then there's increase in spread.
Not only does the UK variant infect children's bodies faster, but it's spreading even quicker because COVID precautions are being relaxed.
People are really getting fatigued with masking, with hand hygiene, with social distancing.
Infectious disease specialist Dr. Gregory DeMurray says the problem isn't inside school buildings. Schools are doing a great job of distancing and wearing masks.
I think where things have become lax has been with sporting events, and there have been a number of outbreaks and a lot of cases that we're seeing that have been associated with sports and other youth activities.
Dane County has seen a big increase in COVID cases in kids 8 to 17 over the past 4 weeks. With an outbreak at a daycare earlier this month, there have been nearly 470 potential outbreaks in educational settings across the state. An MMSD spokesman told us the district has no plans to change their staggered reopening because none of these happened in its buildings. Even though the spreading is happening mostly after school, Dr. DeMurray says schools need to speak up.
The message we need to send, that school districts need to send, is that masks are mandatory, and they're mandatory for sports participation. They're mandatory in any kind of social setting.
But the WIAA isn't convinced the virus is spreading during games.
You don't show up on the field and get COVID. It doesn't pop up on the field. It's got to be brought to the field. So where did they get it? And has it been spread from there?
Deputy Director Wade Lebecki says he hasn't seen any data to prove school sports are to blame for the spread, instead pointing to other social events like team meals and get-togethers. Still, masks are encouraged, but players on the field don't have to wear them.
Right now, we're following what we do have, and we don't have anything that is telling us that we need to change.
The original coronavirus didn't affect kids as much, but this UK variant is proving to be more serious, but still it presents itself like a cold. So things you should watch out for: that's still runny nose, a cough, a sore throat, a fever, diarrhea, or vomiting. If you're seeing any of that in your kids, you should talk to your doctor.